Hey guys, it's Dr. Justin Marchegiani here. Today's video is going to be on histamine and your gut function, why it may be causing you to have brain fog. And we'll kind of define and talk about what brain fog is. Most people have it and they don't understand where it comes from. We're going to make that connection for y'all. Before we do, please smash that like button, give me that thumbs up, and put your comments down below. Let me know about your experience with brain fog and what you've done to help improve it. So off the bat, what's brain fog? Brain fog is this inability to think clearly. It is what it is. So you're literally thinking in the fog, whether it's hard to recall easy facts that you should have, whether it's fluency in speech, easy to recall facts, being able to memorize or absorb information, whether it's at work or at school. And again, a lot of this is driven through inflammation in the gut, right? So inflammation is bidirectional. So it goes both ways. So imagine you have inflammation in the gut. Inflammation in the gut can be from food allergens. It can be from bacterial or microbial or infection imbalances. It can be from the inability to break foods down adequately, whether it's some kind of an intolerance where we're not able to break that food down. And then, of course, the stress of those foods and microbes can easily get into the bloodstream through the tight junctions. And when they're in the bloodstream, that can create more immune stimulation, more immune imbalances, because your immune system is seeing different lipopolysaccharides or different bugs or different undigested food particles that it normally wouldn't see. And that can create some immune stress that can hyper respond the immune system. It can create more food allergen issues. Obviously, a lot of these inflammatory compounds can make their way into the blood-brain barrier, BBB. That's your astrocytes that essentially create that blood-brain barrier for you. And when these different compounds can, activate the immune system in the brain, the microglial cells, this is where you may have more immune activation in the brain, and that can actually create more cognitive issues because the more the immune system is active in the brain, that's where you're going to have more of the brain fog symptoms, the poor memory recall, the lack of speech fluency, the ability to absorb and assimilate and then regurgitate information. You're gonna miss a lot of that information. So got to get to the root cause. So histamine is part of an immune reaction that is going to be released from typically your mast cells, usually in the tissue. So you have basophils in the bloodstream. When those cells go into the tissues, they can actually they become mast cells and they can produce histamine. And so histamine, it's actually kind of a neurotransmitter. It's there to help signal cells. It's part of an inflammatory reaction. So if you got a black eye, for instance, there's going to be a histamine response and you're going to have swelling in that eye and you're going to have immune reactivation in that area. Why? Because your immune system is telling the body, let's bring immune cells there. Let's bring fluid there. So you'll see swelling and you'll see more immune activation. Now, that may be okay when that immune system is activated acutely. Not that big of a deal. The problem is when we have this chronic low-grade inflammation there, then these cells are always reacting. They're always producing histamine. They're always producing fluid retention. And obviously when the cells in this stressed out immune response, the more stressed out and the more your immune system is responding to low-grade inflammation, the more that's going to shut down your body's ability to break down foods and proteins and absorb nutrients. Because when the body's stressed, it's not prioritizing digestion and recovery, it's prioritizing dealing with that stress. And so, of course, when you're chronically inflamed and you have bacterial imbalances, these bacterial imbalances can lower your DAO levels. It can lower your histamine levels. It can lower your DAO, which is an enzyme that breaks down histamine. So DAO stands for diamine oxidase. You need B6, you need vitamin C. These are important nutrients that help make diamine oxidase. The more stressed you are, the more you have IBS type of symptoms, whether it's nausea, bloating, diarrhea, constipation. Usually it's because of these underlying symptoms that we're talking about, whether it's, more system imbalances, low stomach acid, low enzymes, biliary insufficiency. A lot of these microbial imbalances can either stimulate histamine production in the body, they can stimulate histamine production by themselves endogenously, and obviously the stress of these microbes can also decrease your body's ability to make DAO and to metabolize these histamines. And of course, we talked about inflammation being bidirectional, so inflammation and stress outside of the gut. Let's say I'm chronically emotionally stressed, or I'm exercising too hard, or I bang my head and create trauma. That can actually create two-way inflammation and it can affect the gut. And inflammation in the gut from foods and microbial imbalances can create inflammation that can work its way out of the gut into the bloodstream and then cross the blood-brain barrier, cross those astrocytes, and actually create more inflammation in the brain. So it's good to have an understanding of like, okay, what are the system imbalances in the body, gut and hormones that are driving it? Where is the histamine coming from? The histamine's coming from poor digestion. Histamine's coming from immune activation. The immune activation is coming from food allergens, fermentable carbohydrates, inability to break down foods. It's coming from microbial imbalances. And of course, those microbes themselves can also increase histamine production via themselves endogenously. And so everything comes full circle. And so you got to really get to the root underlying issue with your foods, with your digestion. You have to get the microbes under control. You have to calm down the immune system. You have to calm down the inflammation. You have to work on the inflammatory stress handling system of the body, which is part of the adrenals and that whole parasympathetic nervous system. And then, of course, we can always do and give nutrients to help calm down the histamine response and provoke really good inflammation, quelling or quenching in the brain, whether it's quercetin, glutathione, curcumin, or resveratrol. These are all excellent compounds to really calm down the inflammation. Again, this is Dr. J here. If you enjoyed today's video, give me a thumbs up. Really appreciate it. Share it with family and friends. There'll be a link below if you want to reach out to myself and colleagues for a consult. We're available worldwide to help you guys out. If you want to reach out, there'll be that link down there for you below. And we are happy to get to the root cause if you guys are struggling. All right, let's dive into some questions here. What is cooking? All right, I'm going to try to skip to questions that are relevant to today's video only if we can, guys. All right. All right, very good. Grace writes in, Dr. J, I hope you're doing well. I'm wondering what your thoughts are on gum recession. So gums are typically going to respond to inflammation. So the first thing is make sure you are working on having a really good diet that's anti-inflammatory. There also could be some bacterial issues in your mouth. And so, of course, decreasing some of the strep or the staph mutants can be very helpful. So you can always flush with a little bit of silver or 3% hydrogen peroxide diluted just to kind of decrease some of the microbes that could be feeding or producing a lot of acids. Again, usually those foods that feed those microbes are usually sugar, refined sugar. You can get a toothpaste that has maybe some xylitol in there. CoQ10 is very helpful to rub on the gums. It helps with gum health. Obviously, taking some internally is great, and making sure there's no gut issues. So you're absorbing all those nutrients adequately. And then I talked about the xylitol toothpaste. I like the Revitin toothpaste as well. We'll put a link down below for the Revitin. I like that. There's some pre and probiotics, and there's some CoQ10 there. That's wonderful. And I would just say making sure the gut is good, and collagen is really helpful for connective tissue. So that would also plug into the gum, and so is CoQ10. Yeah, it's definitely possible. I mean, having a good routine of flossing and doing those kind of things can be good. Obviously, decreasing things like smoking and inflammatory foods, all those things are great. Can you tell me what the cause of succinic and malic acid markers are on an O test? So usually those type of markers tend to correlate more with CoQ10 and mitochondrial nutrients, usually CoQ10, sometimes B vitamins and magnesium. So really making sure that you have enough of those nutrients on board. Sometimes you could just be under a lot of stress where your body's just burning more of it than you're even getting, even in an adequate level. And then, of course, the absorption, making sure you're getting enough really good nutrient-dense foods that are going to have those foods in it. Good question. Dr. J, I took cholestyramine for a couple of weeks in April to treat mold illness, and I have been having GI issues like nausea and having diarrhea since. I have SIBO and parasites. Yeah, I mean, so I typically don't like to go push any mold detoxification until the gut is dialed in because of this exact reason. Because if you're pulling a bunch of mold toxins out through the liver gallbladder, that dumps it into the small intestine. Well, that could potentially create inflammation, dumping all that stuff there, and then you could create more gut inflammation. So I always prioritize dealing with the gut before we go directly after the mold. And if we go after the mold, we may use some gentle binders that are ideally not going to cause problems. So if what you're doing is causing problems, just kind of step back and really focus on the gut. Try to decrease your mold occurrence via where you're living. Work on that. Good, high-quality Austin Air filter. HealthMate Plus is the one I recommend. We'll put a link down below. If you guys want to reach out, we can offer 10% off on that. That's one that I have in my office down here, as well as throughout my house. I like it partly because it's got your standard HEPA filter, which any good filter has a HEPA filter, right? That's a 0.3 micron filter. The next step is what else is there? And so with the Austin Air Health Mate Plus, there's 30 pounds of activated charcoal and zeolite, and that will filter out a good bit of mold toxins, volatile organic compounds, various other pesticides, or any junk that could be mobilized in the air. And then also, you don't have to change it but once every 5 years, so that's kind of nice. And also, you got to get to the root cause. Like if you're putting that Austin air filter in, you know you have mold in your home. Ideally, you want to get to the root issue of the mold. So if it's like a water leak, well, then you just got to cut that out, fix the leak, and then hopefully you're good. And then you treated that appropriately with maybe 20% hydrogen peroxide and the biobalance solution and essential oil solution. If it's like from an environment issue, like high levels of humidity, then you got to work on that. Could the CSM have interacted with those? I'm trying to figure out why CSM affected my body so badly. Are you familiar with porphyria? I am being tested for that as well. Thank you. I'm not sure what CSM stands for. Is it not chronic fatigue syndrome? I can't think of what CSM stands for. You'll have to help me out. So porphyria, so I know pyruria, that has to do with B6 and zinc. But that usually, you got to fix all the gut. A lot of these weird issues, people that kind of throw a diagnosis on things. I always look at dealing with the underlying systems that may not be functioning optimally before I go down rabbit holes for very unique diagnoses. Because a lot of these diagnoses, they don't tell you what the problem is. They're just a fancy way of saying you have these symptoms. But okay, great, we have a name for these symptoms, now what, right? And so we got to go upstream to the systems that may not be functioning optimally and see if those systems are driving the downstream symptoms. Conventional medicine gets super fancy and, well, let's figure out what name this is, but in the end, does that name change anything? Now, conventional medicine, it may, because it may allow them to get paid from an insurance perspective. There may be a drug they can prescribe for it, right? But in functional medicine land, it's a little bit different in how we look at that. All right, and then struggle with nasal clogging after drinking alcohol, especially beer. Any ideas why? I mean, there could be gluten. It could be histamine. There could be impurities in the alcohol. All those things are up for grabs. All right, very good. So NSAIDs obviously not good. What's a good pain reliever that's also not inflammatory? I mean, so NSAIDs, I mean, acutely, if you're a really healthy individual, not that big of a deal if you're doing it acutely, right? But if you're doing it chronically, you really want to think about ginger, magnesium. You want to think about natural, like liposomal curcumin, or like boswellia or white willow bark. Those are much better natural alternatives that aren't going to be as deleterious. All right, guys, hope you enjoyed today's video. If you did, feel free and click down below. Reach out to myself if you want more support. We are here to help you worldwide. You guys have a phenomenal day. Thanks. Take care. Bye now.